Today topics keloid and hypertrophic scars. So scars are the normal part of wound healing, but sometimes healing goes wrong. So why does a scar sometimes even confined to the wound, while in other cases it goes beyond the normal limit? Today we will clearly understand the keloid and hypertrophic scar, a very common clinical condition and high yield exam topics. So what is scar? Scar is formed when normal wound healing is disturbed and leading to the excessive collagen deposition. So, scar is a form when normal wound healing is disturbed and that lead to the excessive collagen deposition, and that is called as the formation of scar. So, that is the abnormal result from the disorder of wound healing with excessive collagen deposition. There are two types, two important abnormal scar, that is hypertrophic scar and that other is a keloid. So let's start one by one. First is a hypertrophic scar. So hypertrophic scar is a rise edematous scar that develop after wound healing but remain confined to the original wound margin. That is the one main thing. If there is any surgical scar, that scar will be remain to the confined to that margin of the wound. Does and usually appear within a week of the injury and may regress spontaneously over the time. But another type is keloid. So what is keloid? It is a benign fibroproliferative disorder that show the extreme overgrowth of scar due to the overproduction of collagen during the wound healing, and scar tissues extend beyond the original wound margin, and that appears within the month after injury appears month after injury and continue to grow. That is does not regress spontaneously, has a high recurrence rate. That is the main thing you have to understand. So main thing from the keloid point of view is it is a beyond the original wound boundaries and it does not regress spontaneously, so it has a high recurrence rate. Next, now what are the etiological and the risk factor for this? Main etiological scar and keloid are mainly developed after the surgical incision, trauma, burn, or acne vulgaris, or ear piercing. Ear piercing is the most common for the keloid. It important risk factor for the and important risk factor include the genetic predisposition, darker skin individual, and the young age, as well as the area of increased tension, skin tension that lead to the scar formation and lead to the inadequate wound closures. So what are common site that usually is the scar occur? For the hypertrophic scar, usually it can occur anywhere. So mainly in the surgical wound and the burn scar, flexor surface area of the area of tension. So hypertrophic scar can occur anywhere in the body, whereas the keloid has a special place. For the keloid, usually are the classically seen on the ear lobule. These are the most common site for the keloid is the ear lobules. I just got the ear lobules and have the pre-sternal area, that is in the chest area as well as the shoulder and the upper arm and the upper back areas. So what is occur? What is the pathogenesis of the basic problem is a prolonged inflammatory phase of wound healing. Prolonged inflammatory wound healing with excessive fibroblast proliferation and there is increased collagen synthesis but reduce what collagen degradation. So main thing is increase synthesis and reduce degradation, as well as there are the over expression of the tissue growth factor beta, that is organized in organized way. But in case of keloid, there is excessive type 1 collagen we have the which is the thick, hyalinized, as well as the disorganized. So main thing you have to understand for the pathogenesis, it is a prolonged inflammatory phase of healing. Why occur? Due to the excessive fibrous proliferation, either increased synthesis and decreased degradation. So what are the clinical features patient presents? Mainly patient will have the clinical feature. This is hypertrophic scar are the hypertrophic. First, we is the hypertrophic scar. Hypertrophic scar is a raised from the surface. It is red as well as a form scar, but it is confined to the wound. It does not spread beyond the boundary of the injury. So it is mainly pale brown in color, but non it is non-painful, non-tender, and it has gradually flattened with the time. That is gradually decrease. Recurrence less. But in case of the keloid, it is a form. It is keloid. If you see here, this is a form robbery nodular lesion. Extend beyond the lesion, extend beyond the margin of the wound, like the claw-like process. And it have the main symptom is a severe itching, tenderness, and may patient have the cosmetic concern. And it may be the bluish or pinkish in color and has the progressive growth. So, how you differentiate between the keloid as well as the hypertrophic scar? So let's this keloid is extend beyond the wound, but hypertrophic scar is confined to the wound. Well, onset of the keloid is late, whereas onset of the hypertrophic scar is early, that is within a week. What is class late? That is in a month. Well, if not in natural history, if we look, the hypertrophic scar has the low regression, but in case of the keloid, it has the progressive in nature. Well, the recurrence after the treatment is rare in case of the hypertrophic scar, but in case of keloid, there is a high chance of recurrence rates even after treatment because their genetic predisposition is present in case of the keloid, whereas there is no genetic predisposition in case of the hypertrophic scar. Feature is main feature is it is a non-vascular, tender, non-tender, as well as a non-itching. But in case of the keloid, it is a vascular and it is a tender as well as a itching. Well, side I have already said that hypertrophic scar can occur anywhere, but in case of keloid, it occurs in the chest wall, earlobe, and the upper arm. It can be occur anywhere. Now, if you feel difficulty in memorizing these things, just looks one trick. That now what is keloid and what is hypertrophic scar. So first understand keloid. Keloid means if K for kill. Understand the kill. Yeah, you must have the watch the movies that's called serial killer. If they're serial killer, mainly used to kill the person, and if they and mostly we see that there is a family history that it become the any history in the family and that become the killer serial killer. And if they become the serial killer, they used to kill the person, and after killing they give the pain. No, and that become the it has the not this serial means what one killing after the other after it means there is a progressive increasing the so there is a not limit for them. So in the simple way, keloid for kill for the serial killer have the no limit, so it will go beyond its normal limit. It has the progressive nature and it has the tenderness. It gives the pain, that's called blood. It has the cerebral fluid. So mainly where used to killer used to kill mainly in the chest and not the earlobe. So you can know that from here we can understand what hypertrophic scar and the keloid. For hypertrophic scar confined to the wound. For the keloid, it is extend beyond the wound. It mainly hypertrophic scar in the week, it is month, it is slow progressive, it is a progressive regression, whereas the recurrence rate after treatment is rare, but in case of keloid is common. Genetic is present in case of keloid. So in one case of the histopathology, we can within the hypertrophic scar there is an increased fibroblast, and that shows the parallel collagen fiber which has the organized bundle and that increase the vascularity. But in case of keloid, there is a thick eosinophilic hyalinized collagen bundle and that show the disorganized arrangement and have the few blood vessels. Now, diagnosis is mainly clinical and biopsy is needed unless there is a rarely needed unless there is a diagnosis is doubtful. So what is the treatment? Main management, the main aim of treatment is to control the symptom, control the as well as the symptom and reduction of the recurrence. So not complete cure. Combination of therapy is required. So main is a general principle consists of the early treatment improve the outcome and combination therapy is preferred and patient counseling is essential. Main aim of treatment is to reduce the symptom as well as the recurrence rate. So what are the treatment for the keloid and your hypertrophic scar? So For the hypertrophic scar, main treatment is we can silicone, gel sheet, pressure therapy, intralesional corticosteroids, laser therapy, cryotherapy, or surgical revision in case of selected case. Well as in case of the treatment of the keloid, for the treatment of keloid, first line treatment is a intralesional corticosteroid injection. Intralesional corticosteroid injection that is most commonly used is the triamcinolone. We give the injection of the corticosteroid in the lesion. Direct is in the lesion we give the steroid that is a triamcinolone. And other modality we can use are the silicone gel sheet, pressure therapy, cryotherapy, laser therapy, surgical excision followed by the steroid injection. So we never do the no, surgery alone is very high risk rate. So always after surgical excision followed by the steroid injection. Radiotherapy prefer if there is a refractive case. So how can you prevent this? Yes, prevention include for wound closure, minimize the wound tension, avoid the unnecessary surgery in the keloid prone individual. Early steroid injection in case of the high risk wound and silicone gel application is post operatively can be used. So what are the complication category? Main complication is the pain, itching, but main pain is cosmetic disfigurement in case of the keloid, as well as the patient having the psychological distress. And the recurrent growth is more common in this keloid. No, for for exam, always remember keloid extend beyond the wound margin, whereas the inhypertrophic scar remain within the wound. Whereas hypertrophic scar may undergo regression, but in case of the keloid, it go progressive. Most common site for the keloid is a ear lobule, but case for the hypertrophic scar, it can occur anywhere. Best initial treatment for the keloid is a intralesional steroid. So scar extending beyond the wound margin is called as a keloid. Whereas the collagen type in keloid is a what is collagen type in keloid type 1. Whereas the first line treatment of the keloid is a intralesional triamcinolone. Scar that regress spontaneously is called hypertrophic scar, and scar that go progressive is called as a yes keloid scar. So keloid and hypertrophic are the scar are the most known topic for MBBS and PG interns exams. So thank you.